educate yourself. If you see somebody, a friend, that looks like things are changing or they talk about stuff that's not right with them, say something to them. Don't just ignore it, don't blow it off.
You think I go get my well women's checkup and I have a pap smear every year, I'm good to go. No, these symptoms are different.
Started having some symptoms of indigestion, nausea, constipation, on and off.
I didn't realize that the symptoms were so common, just everyday symptoms. It's really eye-opening.
You know, the symptoms are very vague, and mimic many other diseases. Well, I think most women, they need to advocate for themselves. Trust your gut. If you know something's wrong, especially if it's persistent for longer than 2 weeks, most of the women that I know have had to fight for a diagnosis because it simply wasn't on anybody else's radar.
They have to be pushed for additional testing that is not part of a routine exam.
Because you think you go in for your yearly and you are covered, but realistically you're not, so you'd have to ask to get the testing done for it.
There's no screening that happens currently regarding ovarian cancer.
Pap smears don't screen for ovarian cancer, and that's something that I feel a lot of people have a misconception about.
All female patients are at risk for ovarian cancer.
The relapses can be 40 years later. It can come back in 6 months, it can come back in 40 years. Exercise and work on the diet and keep stress low to increase the likelihood that your immune system is good.
A lot of the studies looking at prevention are looking at screening techniques. Are there new tests? Are there new modalities we can use to identify patients with cancer early or even prevent people from getting ovarian cancer at all? As far as when patients are diagnosed with ovarian cancer, there's a huge push to figure out what the best way to treat them is. So, when is the right timing for surgery, how extensive our surgery should be, and then of course in patients that recur, we're looking at new therapies to see if we can better fight this disease.
You can make a difference in the life of women all over the world. Visit judysmission.org.